Hi, I'm Wayne Baker. I'm the candidate for the Perth-Wellington PPC party, and I'm here to interview Dr. Ron Brown. Dr. Brown has a PhD in organizational psychology, specifically health promotion, and he's working on his second PhD in epidemiology. He currently has 3 peer-reviewed articles on COVID-19 in major medical journals, and he has a 4th article that's currently under peer review. Dr. Brown, good to meet you.
Nice to meet you, Wayne.
Yes. Tell me a little bit about yourself.
Well, as you said, I'm in the middle of my epidemiology dissertation, my second PhD, and I got sidetracked, as everybody else did, about a year and a half ago with COVID-19. So I've turned my research skills onto the topic of COVID-19, and I've been investigating the actual causes of this pandemic, and I've come up with some unique insights that are published in my articles, and now I'm trying to disseminate that information to the public because I feel this offers explanations that will be of interest to the public and perhaps some suggestions for solutions on how we can get out of this mess that we find ourselves in. Well, one of the things I've investigated was the intersection between how public health policy is formed under the pandemic and under these emergency orders, and how it intersects with politics and the way we run our governments and the way we structure our society. So that's why I'm interested in talking to somebody like you who's in politics, because I think it's important to arm you with the information that you can then help me convey to the public so that we can enlighten people and possibly get more action from the public to help end this pandemic. Because right now I don't see any end to this pandemic. Already cases in Ontario are going back up, and emergency orders are in place to lock us down again. So it's just a question of time, in my opinion, before the 4th wave locks us down for the winter.
What's your opinion on the 4th wave? What's your opinion on COVID as a whole? Encouraging and overreaching philosophy of government.
Yeah, I think we have to look at pre-pandemic ways of doing things. Before the pandemic, public health would investigate new microorganisms that were involved in epidemics and pandemics and take a while to determine whether they were actually dangerous to society or not. But they did that working within the framework of our rights and freedoms. It was never a question that we were challenged to give up our rights and freedoms for the sake of public health research until the pandemic. So for example, before the pandemic, we had SARS, we had HIV, we had other influenza microorganisms, all Ebola, all declared pandemics at one time or another. Some of them people weren't even aware were pandemics at the time. And we went about our business as usual. In the meantime, the epidemiologists and other researchers went about their business to do the investigations required, the rigorous studies required to actually determine the spread and the severity of these pandemics. Right now, we're lacking all those epidemiological studies. We have this new genomic sequencing information about these viruses, and we're translating directly into public health emergency measures. We skipped over the epidemiology vetting because it's the epidemiology rigorous studies that can tell us, well, how dangerous are these microbes? Just because we have a new genomic sequence doesn't mean necessarily that it's a new microbe. And this is a very important issue. You have to understand that genomic sequencing is a relatively new technology. it only started about 15 years ago, and then it wasn't very good, and it's become refined over the course of years. So now we get to the point that in 2019 in Wuhan, they were able to do a rather sophisticated genomic sequence of what was turned out to be a pneumonia virus. And they said, whoa, this is a new genome we've never seen before. Perhaps it's a new virus. But even the people who conducted that research in Wuhan at the time said, we need to vet this more with epidemiological studies. Well, that's the part that people seems to have neglected. They just went right from, oh, it's a new genome sequence, oh, it's a new virus, oh, we're all going to die, oh, we better do something that we've never done before, give up your rights and freedoms, and we'll take care of it. And this is ridiculous. And there's another reason why we gave up our rights and freedoms so quickly. And that has to do with, in my opinion, the misinterpretation and bad advice coming from the World Health Organization based upon the events in Wuhan. So, in China, it might be shocking to people to realize that within the past year and a half, only 2 people have died from coronavirus out of a population of what? 1.3, almost 1.4 billion people, right? And this fact is lying there in plain view, and nobody's picking up on this. Like, this is stunning. Compare that to what's going on in the rest of the world and how many hundreds of thousands of deaths we have from coronavirus in just the past year and a half alone. Never mind going all the way back to the beginning of the pandemic, compared to 2 deaths from coronavirus in China. What's going on here? And why aren't politicians picking up on that? And why aren't they asking those questions and demanding information to uncover what the real truth is? We're not even looking at this.
That seems like a huge disparity to me.
So let me explain how that came about, because that is the latest research that I've been conducting, and that's the research that's currently under peer review. What happened is, basically, China used a different type of a case definition. It's called a diagnostic case definition. And that's different from the other case definitions that the World Health Organization is having other nations use, which are known as surveillance case definitions. Diagnostic case definitions are very narrow. They're supposed to use something called differential diagnosis to specify exactly what the disease is, right, and what's causing it. Whereas the other types of surveillance case definitions are the exact opposite. They're very broad to cast a wide net over society, especially in cases where we have a new unidentified microbe. We want to know all the information we can about it. And so we have these very broad case definitions. In fact, it's so broad now that if you test positive for the infection, even if you don't have any symptoms, you are still a case. You are diseased. We've never had that before, right? This is only due to the surveillance definition. So we have these 2 different philosophies, in a way, of how to go about diagnosing these diseases. China is using the diagnostic case definitions, and we're using the surveillance case definitions. And so China's case definitions are so narrow that there's hardly anybody that even qualifies as a coronavirus death. They don't even call it coronavirus. The first 4 cases in Wuhan were actually pneumonia cases, severe pneumonia cases connected to the Wuhan seafood market. It turns out that almost half of those cases really had no connection to the Wuhan seafood market, or to anybody that had any connection to the seafood market. So the investigators in China discovered that there was a new microbe, or let me put it another way, they discovered a new sequence of a microbe, right? See how easy it is to make to confuse the 2 things? They're not the same thing. So, well, we've never saw this before, so this must be a unique type of virus causing a unique novel pneumonia. So we'll call this novel coronavirus pneumonia, right? NCP. So that's what they call it now. They don't call it SARS-CoV-2, right? Novel coronavirus pneumonia. And so their case definitions are diagnostic. So they say, okay, if you have pneumonia, you have to have this organism in it this virus. But if you don't have any other, if you have any other virus with it, then we can't call it novel pneumonia, novel coronavirus pneumonia, right?
Okay.
So that eliminates, over 80% of people that would normally be diagnosed with this and normally, diagnosed as dying from it too. So it's so severe that there's hardly anybody that qualifies under that case definition anymore. That's why they can only report 2 deaths in a year and a half, right? Now, does that mean that people aren't really dying and getting sick? Of course they are. They're just not being reported, okay? And we're doing the exact opposite. So let me just talk about what we're doing. With that surveillance case definition that's so broad, again, that serves its purpose because we can see, for example, all these comorbid conditions that are connected to COVID-19, right?
Yeah,
Let's say you have diabetes or hypertension, or you had a stroke, or you have arrhythmias. These are all associated with COVID-19. And it's important to know that because that gives us clues as to what might be a common underlying cause, for example. However, when you collect all this information and you report it to the public, you are supposed to take out all of those extra, broad cases, because you're not really if you leave them in, you're not really reporting the actual cases and deaths from severe acute respiratory illnesses. Remember, the name of the virus is SARS-CoV-2, severe acute respiratory syndrome.
Yep.
There's only certain types of diseases that fall under that category. And by the way, pneumonia is the most severe of them, right?
Okay.
So
Yep.
most of the people dying of this are dying of pneumonia, just the way they are in China, all right? But if you're reporting all these other conditions that are contributing to this, it's inflating, and people suspect this all along, right? And here's the explanation. It's inflating the counts.
Yep.
It's inflating the case counts and the death counts, okay? By how much? The only way we can figure that out is to go back, sorry.
You've got a yellow jacket.
As long as they leave me alone, they can visit, but if they try to extract anything from me, that's another issue. Okay.
Well, they usually inject.
Oh, yeah.
Those guys do the injections.
Yeah, okay. Well, okay, no injections, right. So I might have to put on my sweatshirt here. Right. Well, where was I?
So you were talking about pneumonia and SARS-CoV-2?
Yeah, so to get the actual number of count of cases and deaths, you have to take away all those other related conditions. And the only way to do that is to actually go back to the raw data and go through the coding and take out all of that other stuff. But nobody's doing that. Not only that, even when the cases and deaths are reported in the media, do they ever say, warning, these are for surveillance data purposes only and do not reflect the actual cases and deaths? Has anybody ever heard that in the media?
No.
Of course not.
No.
But, a serious epidemiologist understands that. So why aren't the epidemiologists out there explaining the difference between a surveillance case definition and a diagnostic case definition? Right?
Are they being told not to step up?
I think it's just incompetence. Let me give you another example of incompetence from the World Health Organization. Because back in February 2020, World Health Organization had formed a committee with Chinese scientists. And they worked together, and the director of that committee was Bruce Aylward, who's a Canadian physician, by the way, and he's from the World Health Organization. And he was so impressed with how China reduced their cases by 80% in February of 2020 that he told the world in a press conference that everybody should do what China's doing. And guess what? Everyone's doing it. So we have imported a Chinese-style, dictatorship-style, communist-style, totalitarian, authoritarian style of public health measures. China has no regards for rights and freedoms. That's the system that we are now operating in. That's where all this came from. Because Bruce Aylward and his committee told everybody China just reduced their cases by 80%, so everybody should lock down and forget about your rights and freedoms and do what China did, right? Not realizing that what had really happened...
Two different standards of numbers. Or
exactly.
counts.
China's case definition had changed their case definitions by that time. And the proof of it is they published their case definitions in March. of 2020, right? And there it is, and I've got that information in my latest article that's under peer review. There it is right there. Differential diagnosis. They don't not using surveillance case definitions. By the way, who meaning World Health Organization, also who is the organization, which is the World Health Organization, told the world that there's a difference between surveillance case definitions and diagnosis case definitions. The World Health Organization, their own literature states that. And yet Bruce Aylward from the World Health Organization didn't seem to understand that. And he personally, and the World Health led the World Health Organization to mislead the entire world to follow China's communist, no rights and freedoms, dictatorship method of public health. And that's what we're dealing with right now. This information needs to come out. People need to understand the truth about how cases and deaths are being counted here. And if you, this is now my opinion, if you were to subtract all the cases and deaths that have nothing to do with severe acute respiratory diseases, my speculation is that you'd wind up with pretty much the same mortality that you see every year with the flu and pneumonia.
I've heard that.
So let's do it. We need the scientists to actually go back at that data, and I don't have that power to do that, but I have the power to at least tell people what I've discovered in my research. So there you go. Here's the point. Now what can you do as a politician? You can show people how our rights and freedoms are being compromised by this public health strategy, right? But people are going to protest and push back and say, yes, but we need to protect our health. That's where you can start filling in the missing dots and say, but is it really protecting our health, right? And this is where this information comes in. Let's go back and see how this all developed, right? Now, it's not a quick and easy explanation. You have to connect the dots very carefully. So I'm not expecting that this is going to change everything overnight. But this is what the evidence is showing. And if you can find any evidence that refutes anything that I'm saying, let me have it. You know, I'm in favor of evidence, period. No matter, I don't go into an investigation with a preconceived notion of what I'm going to find, right? I let the evidence tell me where I'm going. Yeah. If you have evidence to say, Ron, that's not true, this is true, fine, we'll pivot in that direction. The point is, follow the trail of the evidence wherever it goes, okay? But this is the evidence so far that we have. And this evidence is showing that we've got real problems that are solvable with knowledge and with the dissemination of the truth and with turning around political policies to align with the truth rather than aligning with this communist dictatorship method. Now, if you put it in those terms, I think you might be more successful. You ask people, which do you want? Do you want our old-fashioned but trusted and appreciated method of our rights and freedoms, or do you want to adapt a communist method of no rights and freedoms to control your public health? Start with there and then work back from there. That's my advice. Just, you know, what you think. Just, you know, the difference between me and these other experts is you get opinions and speculations and guesses from everybody else. I have opinions too. Yeah. But they're based on evidence and research that I've actually published on COVID-19. Okay? Because this is what I've been dedicating my life to this for a year and a half. Right? Put me up against any of these so-called virologists, right? How much research have they actually published recently on COVID-19? You know, how up to date are they and on the literature? And how expansive is their perspective that puts this whole thing together, that connects all the dots, not just the dots from their little specialty. I think what I'm offering is unique in that I'm taking that approach. This is the method, research method that I learned in my first PhD. It's called grounded theory. This is basically an investigation method.
Okay.
And that's exactly what I'm using. And before I started investigating COVID-19, I was working on investigating chronic diseases like cancer and heart disease and diabetes. And it was going very well using this type of investigation because the literature is right there. It's what's needed is for somebody to come along and piece together all the parts and to synthesize into a new perspective, a new outlook. And from there, we can then start to develop hypotheses to test all of this stuff.
Okay.
Okay, so nothing that I'm published in my article has actually been tested yet at a clinical level yet, but that's to come.
Mm-hmm.
First, you have to get your theories straight, and they have to be evidence-based. You can't just use speculations, right? The evidence will tell you what your hypothesis is, and then you go out and test it. And your results from the testing will then help you to make the modifications you need to keep on moving your theory closer and closer to the truth. That's what science is. It's a question of getting closer to the truth all the time.
Yeah.
When people say you should believe me because it's science, there's always going to be a debate in science. So which side of the debate are you on, right?
Yep.
So don't fall for that. Just follow the trail of the evidence.
Evidence trail, yeah. Yep. Now, let's change tack here a little bit,
Okay.
Ron. I'd like your opinion on the masks and their effectiveness, and the vaccine, or the so-called vaccine, and its effectiveness. Do you have any opinions on that, and the new technology involved with the vaccine?
Well, for the vaccines, I have more than an opinion. I have the actual research that I published. As
Oh,
far
okay.
as the masks go, those are considered non-pharmaceutical interventions. We've always had those. We've actually also had social distancing going all the way back to 1918, right? That's nothing new. Of course, we don't have it at the level that we have it now, where we're locking up totally healthy people, right? And forcing them to stay in their homes. So that's gotten way out of control. But even then, this is interesting about 1918. There was some U.S. Navy studies done to test the hypothesis that the pandemic was contagious and that it could be passed from person to person, right? This was the hypothesis. So they wanted to test that. So they went into hospitals with healthy sailors and they exposed them. They did one trial in Boston, and they exposed them directly to severely ill people with the flu, influenza. That's what it was at the time. By the way, COVID-19 is an influenza-like illness, okay? So there is a relationship there. Getting back to Boston, they found that no matter how much they exposed the healthy sailors to the sick patients, to their breath, to their physical contact, to their sputum, it made no difference. They remained healthy. They couldn't transfer the influenza infection. Now, did they transfer microbes? Probably, but that's not sufficient to actually transfer an infection. An infection is something you develop from within, right? Based upon the status of your immune system, right?
Yep.
So just transferring microbes, according to this study, and this is a clinical controlled study, this is the highest gold standard of evidence you have, refuted that hypothesis that there was interpersonal transmission of an infection, right? So they repeated the study in San Francisco. They found the same thing. And they don't know how to explain it. And it's just kind of laid there ever since and been ignored ever since, right? Because you can't make any money selling treatments, unless you can convince everybody that they have to be protected by medicines and vaccines and all these masks and social distancing. And even back then, the military medical personnel that were supervising all of these interventions like masks, they admitted that the best that we can expect from this is that it might contain the infection a bit. That's about it, right? So that's it for masks. It really has nothing to do with developing an infection. So let me, and I can talk more about that too, but before I do, let me go over to the vaccines. So the messenger RNA vaccines are a new technology, okay? So what is messenger RNA? Well, it's actually a type of, I don't even know how to describe it. It's a microorganism. It's a non-living particle that transfers information from the genes in your cell out into the ribosome of the cell and hands over the copy of the genes to make a protein that the cell needs. That's it. Mm-hmm. That's what messenger RNA is. Once the cell uses that gene information, genetic information, that genetic information is fragmented as waste and packaged in a little bubble inside the cell called an exosome, and then shipped out through the immune system as part of the 1 quadrillion viruses that you have in you right now. Shed through your nasal mucosal system and also through your gastrointestinal system. That's why we can trace it all the way back into the sewage system, right?
Okay.
And this is normal. That's how life works.
Mm-hmm.
So what happens is, sometimes you get an extra viral load in that nasal mucosal system. So the question is, well, it appears that the viruses are replicating on their own. But don't forget, these are dead pieces of genetic material. They can't replicate. So then what's the alternative explanation? Because I understand now, I'm getting into areas that contradict fundamental virology. But I've done my review on the latest virology findings, and this exosome hypothesis is picking up steam. So why are we getting that viral load accumulated? Well, it could be because there are factors that we ingest in our diet, for example, that impair our immune system, so that the immune system in the nasal mucosa slows down, and that viral shedding through the ciliary action slows down, becomes paralyzed, and you have a higher viral load. So that higher viral load is an indication that your immune system is slowing down, is being impaired for whatever reason, right?
Okay. Yep.
It's not because you picked up a virus and it's starting to replicate. Okay? So this is the direction, the new direction of the hypothesis of how viruses are associated with these illnesses. In the meantime, though, that factor that's slowing down the immune system can be causing also the other symptoms, the clinical symptoms of the illness. So you have the viral load or the infection being caused by, let's say, a mysterious mitigating or a mysterious mediating factor. And that mediating factor can also be causing the fever and the aches and the pains, the symptoms of the disease. So if we have the infection without the symptoms, that's known as an asymptomatic infection.
Yep.
We can also have the symptoms without the infection. That's known as long haul COVID, right? Or post-acute COVID-19 syndrome, right?
And that's where someone really doesn't recover from COVID?
Right. But the infection has already subsided.
Okay.
So the point is, you see, they're independent.
Mm-hmm.
That implies that there must be some other mediating factor that's causing both of those. And those mediating factors, in the third article I published, come from things that affect your nutritional status. In other words, your diet. And one of the factors that I found that sodium, excessive amounts of sodium chloride, has that paralyzing effect in your nasal mucosal system.
The salt.
So too much, right? Excessive amounts.
Too
right?
much salt.
And the main contributing factor to excessive salt intake are ultra-processed foods, right? So that could explain the nasal mucosal viral load. At the same time, sodium toxicity also causes fevers. It causes water retention in the lungs, pulmonary edema, which is what's putting people with pneumonia in the hospitals, right?
Yep.
So it causes both. And whether you have one or the other, it's just a question of, which one does it happen to be causing the most in you under your circumstances and your immune system status. Here's the point. Here's the more important point. Whether you agree with this or not, it's all based in literature, right? And I have 245 references in that one particular article. But here's the real more important point. Why aren't we looking for these types of disease-causing factors? Why are we only focusing on vaccines and on these other factors that only contain or treat the symptom?
I hear you.
Right?
I hear you on that one, yes.
So who's doing that work? I am. And I don't know. You let me know if you find anybody else, because this is what basically I dedicate my whole research to. I'm interested. Remember I mentioned before I had studied chronic diseases?
Yeah.
Well, what causes them? In epidemiology, there are two parts to epidemiology. There's the surveillance part. We've talked about surveillance before. What's the incidence and prevalence of disease within a population? But then there's the other part that seems to me a lot of people in epidemiology don't follow up on as much, which is what's the actual determinant, the etiological factors of diseases, and how can we prevent them? Especially the biomedical. Now that we have social determinants, and I know there are researchers that do that kind of work, but it's still, the social determinants are like an indirect factor related to the more biological determinants. Let's get down to the nitty gritty. What's actually causing all this stuff, right? So how many people do that research? Not many. Why? Because there's not that much funding in it. Why? Because you can't develop a patent, on eating right, and you can't sell a treatment, so none of the money goes there, so none of the research goes there. In the meantime, we're stuck with this pandemic that might have a cause that we can modify. Mm-hmm. So, for example, in my sodium toxicity article, again, the point of it is not to tell everybody that we got the proof that sodium toxicity is causing it. That's not what it's saying. It's saying here's a theory based upon the evidence suggesting that this is what's causing it. Let's test it. Mm-hmm. Remember I talked about hypothesis testing?
Yep.
So let's go into the long-term care homes and, have a randomized trial. Put some people, randomize them between a group that's on a low sodium diet and one that's eating, what they're normally accustomed to eating, and see if there's any difference in hospitalizations, infections, right?
Yep.
Let's do that. That takes money though, and takes funding, and you have to have a credible theory to begin with, and hopefully I'm working toward that direction. But that's the type of research we need. Instead, what we get are, we have this new messenger RNA vaccine, okay? Now, I published another article which is breaking all the records in the medical journal that's published in, and which has been cited by The Lancet, which is one of the major medical journals, statistically proving that these messenger RNA viruses are only about 1% effective in preventing infections. 1%. More specifically, the Pfizer COVID-19 messenger RNA vaccine is 0.7% effective, or has what we call an absolute relative risk reduction. And Moderna has 1.1%.
So that leads to the question, why this heavy push?
Well, because that information is not being publicized. What's being publicized is the other statistic known as the relative risk reduction. Okay. And that is 95%. Around 95% for both those vaccines. But here's the thing. The Food and Drug Administration, the FDA, put out literature explaining that when you report the outcomes of these clinical trials, you have to report both absolute and relative risk reductions. Because if you only report the relative risk reduction, you're not getting the full picture. See, what they do is they take the absolute risk reduction, which is simply the number of cases in the control group compared to the number of cases in the experimental group, the group that got the vaccine, right? And that's just, you subtract the difference in the cases. That's it. That's the absolute difference, right? That tells you the real clinical and public health usefulness of the vaccine. But they don't do that. They start with that, and then they divide it by a percentage. Now, I don't know if you remember this in school, but when you divide a number by a percentage, normally when you divide a number by another number, you get a smaller number.
Percentage is
when you divide a number by a percentage, you get a larger number. So that's what they do.
Okay.
They take the absolute risk reduction and say, well, let's divide it again by the control event rate, the number of people, that got the infection in the control group. Right. And so it shoots up to 95%. So it's just statistical manipulation. That's all it is. And that's known as the official vaccine efficacy.
The old adage, figures never lie, but liars will figure.
I like it. Very good. And this has been going on for decades. And so when I first heard that these vaccines were being developed, I thought, this is a good opportunity to expose what I knew was about to happen, because that's exactly what happened, And when the information, the data was published in the New England Journal of Medicine back in December on the vaccines, I analyzed it. I said, yep, the relative risk is exactly what they say, but the absolute risk is about 1%, but they're not telling people that. Okay? And based upon that lie, because if you're withholding information that's vital for you to come to the proper conclusion, that's a lie.
That's right.
Okay? So based upon that lie, we have all of these mandates for vaccines now that are affecting people's, right to earn a living,
Yep.
right to go to school.
Yep. Rand Paul talks about, now, I don't have the right term, but increased use or they modify, like the research was to modify viruses to
Gain of function.
That's it.
You know
gain
what?
Of function.
Okay. That's a red herring.
Okay.
It's an issue, but it's not really relevant. I mean, it just shows you how desperate people are to come up with explanations for why we got into this mess.
Okay.
So I can understand their motivation to follow that trail of evidence, and there's no doubt in my mind that people are lying about that. All right? So that's an issue onto its own.
Okay.
But it doesn't really, in my opinion, address the central issues here.
Okay.
We need people like you to lead movements in the public to get this information out so that we could even ask the right questions for further investigations. Right now, we're not even asking the right questions. That's a good example.
Okay.
Right? It's a legitimate question, but is it the right question that we really need to get us out of this? It seems to be intended to scapegoat China and the researchers, and maybe there's some blame there, but it doesn't really address all the other issues that
address the social issues that you're bringing up, and
the epidemiological
political
issues and the misunderstanding between surveillance case definitions and death definitions and diagnostic case definitions and death definitions, and why China only had 2 deaths in a year and a half. Why aren't people upset about that and screaming about that? Where are the politicians? Where are the scientists? And that's not a hidden fact. You don't need, Freedom of Information Act to get that information. It's right there. Why? That's the question. Why? What's causing that?
What's stopping this information from getting out? That's right. It's
Well, you know what? You bring up a good point. Is it deliberately that nobody stopped me from getting this information? I think it's maybe just incompetence, ignorance, and laziness. Maybe just people aren't smart enough to figure this stuff out. I don't know. But before I accuse people of preventing this information from getting out, now that doesn't mean there isn't censorship. Of course there is. But if you're pursuing legitimate research the way I have, nobody's standing in my way, and that's the way it should be.
Yeah.
I mean, I have an interview on YouTube that's had over a quarter of a million views on the messenger RNA viruses. So I work with Trial Site News. I write editorials for them.
Okay.
TrialSiteNews.com. And nobody's censoring us, right? Because we're publishing actual scientific facts. Now, you can distort those facts, and you can cherry pick facts in a certain way to come to different opinions, but I'm not expressing opinions unless I'm specifically writing an editorial. Yeah, then I'm expressing an opinion, but I don't do that when I write journal articles.
No,
and when I do express an opinion, it's based upon the journal articles. That's the whole point.
Yeah.
Otherwise, why would anybody care about what I have to say?
Are you familiar with Wayne Peters and What's Up Canada?
No.
Okay. He's got his website. It keeps morphing, but he's interviewed 13 professionals of your caliber, all of whom are following similar logic, like in their own specialty.
Right.
Similar logic to what you're saying today, and I really I've relied on that information to go forward.
So I have, like I said, Trial Site News.
Yeah, I'm going to write that down.
Write that down.
Yeah,
because
I will, before you go.
I can't do interviews on every single website out there. So I have to be a little more selective about that.
I do want to review that, and
I have a good relationship with them, and I can pretty much, as long as what I'm publishing is credible and is backed up by the research, it gets up online. Okay. So it's a good deal. And so you're going to hear what's going on in reality if you follow a source like that, right?
Yep.
Remember, the difference between me and everybody else is basically opinions. I have opinions, but I also have the evidence.
Yep.
That's a difference.
You have the evidence that's following your opinions. Yeah.
Right.
Yeah.
My opinions follow the evidence.
That's right. Backwards there. Yeah, your opinions are reinforced by the evidence you've found.
Well, they're not just reinforced; they're formed by the evidence.
Yeah.
That's the way I was actually taught to do it, using the grounded theory method.
Yeah.
Okay, I think we covered it. Get out there, man. We need you.
I'm pushing like.
We need you.
I'm being recorded here, so I'm pushing. I'm really pushing. I'd like
okay.
to say something else, but it's not quite diplomatic.
You know,
enough, but
there's a lot of people out there.
You're the second professional I've interviewed who's against the lockdowns.
Yeah.
And told me the same thing. They need me to win, or she needed me to win, and you're saying the same thing.
Okay. The other politicians, well, again, look at the basic questions that are being ignored. Let's take that China 2 deaths in a year and a half. Why aren't politicians screaming about that?
Well, they should be. They should be. If they're not aware of it, they need to.
So
be,
then, why are you going to elect a politician that's not aware of what the issues are and can't even ask the right questions in the first place?
Or doesn't want to find out?
That could be another issue.
Yeah.
I'm not going to accuse people of that because there's a lot at stake there. Okay, but let's go with what we know.
Yeah.
You are now equipped with information that you can deliver to the public, and that you can organize to demand the answers and ask the right questions. None of the other candidates are doing that. None of the other parties are doing that.
Well,
prove me wrong. Show me.
Oh, I quite frankly, if one of the other parties was doing that, I wouldn't be sitting here as a politician right now.
You're being motivated because you need to do this. You see there's a need for this. Well, that's why me too. You know, I had no desire to be an expert in virology and immunology, you know, and infectious diseases, but I had no choice. And I knew a lot of this kind of stuff, this rat's nest of policies involving infectious diseases was going on for decades. But as long as it didn't bother me, I didn't bother with it. Well, that all changed when this communist system was imposed upon me and locked me down, put me under house arrest, basically, modified house arrest. Ended my interfered with my education, interfered with my social life, interfered with my financial situation. You know, it's just interfered with my rights and freedoms. I have no choice. I have to speak up and do something about this. And putting rights and freedoms ahead is the most important part of the agenda. Do the other parties do that? No.
They're trying to withhold our rights and freedoms.
And the reason is they're appealing to people's fears. They know their voters are fearful, so let's say we're going to continue to protect you doing what we're always doing because you're fearful. Mm-hmm. Let's remove people's fears by asking the right questions and exposing the light on the truth. Yeah. They're not interested in doing that. I've seen no evidence of that. So thank you for inviting me to talk to you.
Thank you for coming.
Thanks, man.
Thank you, Ron. That's really awesome.
Okay. Vote PPC. Together we can bring sanity back to Canadian politics.